President Cyril Ramaphosa has said the National Coronavirus Command Council is considering whether or not the country will continue with the national state of disaster. Trade Union Solidarity and Civil Rights Group of AfriForum have both announced a legal challenge for the legislation. We're joined for more on this by the Progressive Health Forum conveners, Dr. Aslaam Dasoo. A very good afternoon to you, Dr. Dasoo. Thank you very much for availing yourself. So, according to the World Health Organization, it is plausible that the region, meaning Europe, is moving towards an end game. Is it plausible that South Africa is moving towards its end game of the COVID-19 pandemic?
Yes, it's very plausible. Look, I think this is a global phenomenon. We're waiting for the data to demonstrate whether we may be experiencing, a step change in the progression of the pandemic. The Omicron variant seems to have signaled that step change, given the decoupling of cases from severe disease and death, or extensive decoupling. And this is being experienced around the world. In Europe and the United States in particular, the very high number of cases also demonstrate that decoupling, but the absolute numbers are so huge that even with the lower hospitalization, the health systems are taking strain at the moment. But they have recognized, as you indicated, the WHO also, that we are moving towards perhaps, and there's no certainty about this, I need to emphasize, perhaps, especially in 2022, an endemic phase of the pandemic, which means that we're moving out of the emergency phase of the pandemic, and this may allow for the resumption of normal, relatively normal activity, given that the impact of the illness will be no worse than what we experience, say, with annual seasonal flu and so on.
You speak of a resumption of normal activity. This week, the EFF marching to the offices of the Sports, Arts and Culture Department, demanding that sports fans return to sporting stadiums. There was a group with that party, a group of women who sell outside the stadium, and they make a living from that, saying outright that we're no longer asking for the president to lift these restrictions. We're actually demanding it because it's impacting us so severely economically. AfriForum also stating that the state of disaster poses a threat to freedom. Again, I guess perhaps how do we balance the rights, to life and safety of people and the very need for people to make a living?
Well, the first thing I'll say that the only legitimate protest in all of the examples you've given are, for example, the women who sell food around sporting venues and make a living out of that. The political demands are mainly opportunistic. But the important thing is that they are all converging on the fact that the Disaster Management Act has outlived whatever usefulness it ever had. It is now an impediment to us getting to a situation where people can resume normal economic activities, have a generally decent approach to life as they would like to experience it socially. I mean, take schools, for example. This rotational learning has really caused a huge impact on children. We don't need it. Schools should go back to absolutely normal functioning. And all of these restrictions occur under the rubric of the Disaster Management Act. For the National Coronavirus Command Council to now be considering the rescinding of this act is welcome, but they too are a product of this act. And I'll say this much, the act clearly was designed to deal with a situation where the country faces an acute disaster, a massive earthquake or things of that nature. To extend it for 2 years has eroded not only the rights of people, but democratic control of the country, where you've removed parliamentary oversight for far too long, and state excess as a result has really harmed people. So the sooner we get away from this act, the better. The sooner we reimpose parliamentary oversight and revert to the cabinet to exercise whatever emergency measures may be needed in the future. There's more than enough legislation to handle the situation now. I'll say this much also. At the outset, we didn't know enough. And one could understand that the extra caution that the government wanted to take was justified. But that fell away pretty quickly. There's absolutely no reason for it to continue right now. As we know, we have learnt a lot, and as the facts have changed, we have changed our position. We are now pretty clear that there's really no reason to maintain that regulatory framework.
Always a pleasure to be in conversation with Dr. Aslaam Dasoo. He's the convener for the Progressive Health Forum. Thank you for availing yourself.